first off, board certification. Why should we care about it? But to state, I personally did not know this, that barbers used to do surgery, and I was so caught off guard. They used to cut hair and then cut limbs and fix ulcers and lesions. And I was like, and then pull teeth. We've really evolved.
We have evolved.
I would not let my hairdresser cut off my limbs.
Yeah, so that is going back a few hundred years. But yes, there were barber surgeons originally, which I find hilarious that you're figuring this out. But no more do barbers cut hair and also remove body parts. Didn't work out that way. And then the discipline of medicine was created.
Certification is important.
Yeah, so not only is certification important, but certified in the right things is super important. So board certification is something that once you've trained as a physician in a specific specialty, you take these tests. And depending on the specialty, the tests are a little bit different. Sometimes they're more challenging than others. You can imagine the more sought after residency like plastic surgery or ENT or neurosurgery have some pretty demanding tests that you need to take for certification. So for like plastic surgery, for example, you take a written test once you're done with your plastic surgery training, which is anywhere from, is it 6 years or 3 years if you've already been board certified in something else. So somewhere between 6 and 8 years of training. You then get to take a painfully long written test. Once you pass that written test, then you spend a year collecting every surgical case that you've done for that year. Once you're done collecting all those cases, you submit them to the board, the American Board of Plastic Surgery. They review your cases. They pull 5 for you to defend, essentially. And then you go for an in-person exam where you sit in 3 one-hour rooms. It's usually in a hotel room, which is bananas, but that's just how it's done. And
was it you that told me one time some guy walked into a closet and was so embarrassed he stayed there in the board exams?
Yeah, I cannot underscore how terrifying these exams are. So
classic.
So they were talking about how in the good old days, because the setting was a hotel room and you stand outside the door and then you're let in and then 3 board examiners are going to ask you questions, that it was so nerve-wracking, and that now there's rules like the 3 people have to sit in chairs and you have to sit in a chair, but these jokers would like ask questions by laying on the bed or from the bathroom, like just really inappropriate.
Imagine having your preceptor in the bathroom.
Just awful. So anyway, they terrified this one resident so much that when he went to leave, because he thought he had failed, he panicked and went into the closet instead of out the door and then just stood there. Like, what are you going to do?
He's like,
I managed to get in and out of my rooms. It was a little bizarre. So you're in there. 2 of the rooms, the examiners are going to ask you questions about any cases they want to ask you about plastic surgery. And then in the 3rd room, they review the cases that they've chosen from your year of collections. So ENT is also very similar, where you have to take a written test and then you have to present cases. And then general surgery, you have to take a written test. You do the same 3-room situation, but there's no cases to present. All the cases are made up, which was plenty terrifying at the time. It's just, I didn't know there was another level of pain with plastic surgery, with talking about your own cases that you had done. But it's still pretty terrifying because you have to make sure that you're listening carefully as they're asking the question. You don't want to misunderstand what they're asking and screw something up. It's exhausting to be, mentally in the game for 30 minutes while these people are firing questions at you. And then you get penalized a little bit if, like, the first scenario that they feed you, you answer everything correctly. Well, they have to fill the 30 minutes. So the less hemming and hawing you have, then the faster they get through questions. And so in my last room, I distinctly remember in general surgery, I ripped through a bunch of questions. And so they were on a last scenario, and I was just over it. They presented me with a very, very old man who had, I think, a hernia repair and then had maybe a testicular vein thrombosis. Like, what did I want to do? And I literally probably had 30 seconds left on the clock. And I was like, I just removed the testicle. He doesn't need it.
He's fine.
He's fine.
It's
and then
fine.
I left and I was like, I just didn't want to have to explain, taking him back to the OR and exploration. It was like the last 30 seconds of the last room of an hour and a half of all this nonsense. And I was like,
yeah,
I'm just going to mic drop. He doesn't need it. Just take the testicle. And then I was like, left.
I feel like that was kind of like in my school. You would be like, oh, this patient has shortness of breath. And be like, oh, but you didn't find the gunshot, the stab wound, the perforated bowels. I'm like, oh, okay, it's fine.
Anyway, so you can imagine you go through 8 years of training. You do this test. You do a written test that takes 8 hours. You have to travel somewhere to do the oral exam that you've prepped for a year for. And then you finally get to be board certified. And then you have to do maintenance of certification. So every year I take another test and fill out paperwork and pay dues and all of that. So I am a board certified plastic surgeon. Nothing is more infuriating than someone who recently advertised themselves as a board certified plastic surgeon on social media. And she's in Ohio, I believe. And we all went bananas because she considered spending some time with an ENT surgeon who's also not board certified in plastic surgery and doing over 100 cases with him, the equivalent of board certification in plastic surgery. We're like,
you're like, way to undermine everyone that's actually a board certified plastic surgeon.
Nope, not the same thing.
I'm also a surgeon because I work in surgery.
Yeah, I was like, so if I spend a couple weekends delivering babies, then does that make me an OBGYN? It is not the same thing. Yeah, I guess so.